If you are over 60 and taking calcium supplements every day thinking you are protecting your bones, stop for a moment and listen carefully. I hear the same story almost every week in my clinic. Dr. Marcus, I take 1,200 milligrams of calcium daily. My bones should be strong, right? Just recently, a 68-year-old patient named Eleanor told me exactly that. She had been taking calcium religiously for 12 years. No missed doses, high-quality supplements, exactly as her previous doctor recommended. What shocked her was this. Her latest bone density scan showed severe osteoporosis. Her hip bone density had actually decreased by 18% since she started taking calcium. She was not being careless with her health. She was following outdated advice that may have been making her bones weaker, not stronger. New research shows that one very common bone health mistake, especially in adults over 60, can actually increase your risk of fractures, heart problems, and kidney stones, while doing almost nothing to rebuild bone density. I'm Dr. Marcus Chen, and in this video, I will explain that mistake, why calcium alone fails most seniors, and the 5 proven methods to actually rebuild bone density after 60 so you can prevent fractures and maintain independence for decades. Before we dive in, drop a comment with your age and where you're watching from today. Have you been taking calcium supplements? Are you concerned about bone loss or osteoporosis? Write your answer below because your experience helps our entire community. And hit that subscribe button because I share life-saving health strategies like this every week to help you thrive after 60. Most people believe that calcium supplements are the answer to weak bones. But in adults over 60, that assumption is often completely wrong. Bone health is not just about calcium. In fact, taking calcium without the right supporting nutrients and lifestyle factors can be useless or even harmful. Without proper bone remodeling support, calcium supplements just pass through your body. That is why calcium alone often fails. By the time you notice fractures, severe osteoporosis, or loss of height, your bones may have been deteriorating silently for years. Here is the problem. As we age, our bones do not just need more calcium. They need the right environment to actually use that calcium to build new bone tissue. By the age of 60, bone loss accelerates dramatically, especially in women after menopause. Our bodies become less efficient at absorbing calcium from any source. We produce less of the hormones and proteins that direct calcium into bones. Each year without proper bone support increases the chance of life-threatening fractures. I saw this clearly with one of my patients named Robert, age 71. He had been taking 1,500 milligrams of calcium daily for 8 years. He thought he was doing everything right. His wife had osteoporosis, so he wanted to prevent it. When he came to my office after a minor fall resulted in a wrist fracture, I ordered a complete bone density scan. The results were devastating. He had osteoporosis in his spine and hips. What most people do not realize is that calcium supplementation without the critical supporting factors does not rebuild bone. It does not strengthen your skeleton. It often just creates calcium deposits in the wrong places like your arteries and kidneys. In older adults, taking calcium alone often means wasting money and time while bones continue to weaken. This is why so many seniors still suffer fractures despite years of calcium supplements. Now, here is where the first major mistake happens. Most seniors rely entirely on calcium supplements to protect their bones. They assume more calcium automatically means stronger bones. But in people over 60, this approach often does not work. Bone density rebuilding requires a comprehensive strategy, not just calcium pills. With age, the body's calcium absorption decreases significantly. Stomach acid production drops, which reduces calcium absorption. Vitamin D levels decline, which blocks calcium utilization. Protein intake often decreases, which weakens the bone matrix. Without these factors optimized, calcium supplements provide minimal benefit. This is not rare. It is extremely common. That 68-year-old patient I mentioned earlier, Eleanor, was spending over $40 monthly on premium calcium supplements. Same routine every morning, same high dose, same expectation of protection. Yet her bones were becoming more fragile every year. When we implemented the proper bone rebuilding protocol, not just calcium supplementation, her bone density stabilized within 6 months and began improving by month 10. This is why comprehensive bone health strategies matter just as much as calcium intake. If you're finding this helpful, go ahead and hit that like button. It really supports the channel and helps us reach more seniors who need this information. Now, let us talk about the first proven bone rebuilding method, and this one is extremely powerful. Method number 1 is optimizing vitamin D3 and K2 for proper calcium utilization. If you look at most people's approach to bone health, they take calcium and maybe some vitamin D. They assume that covers everything. But your bones cannot use calcium effectively without optimal levels of both vitamin D3 and vitamin K2. These nutrients work together in ways most people never understand. Vitamin D3 increases calcium absorption from your digestive system by up to 400%. Without adequate D3, you absorb only 10 to 15% of calcium from food or supplements. That means 85 to 90% gets wasted. But here is what almost nobody knows. Vitamin K2 directs where that absorbed calcium goes. It activates proteins that pull calcium out of soft tissues like arteries and deposit it into bones where it belongs. Without K2, calcium can deposit in your arteries, contributing to heart disease, while your bones remain calcium deficient. In adults over 60, optimizing both D3 and K2 determines whether calcium strengthens bones or clogs arteries. I saw this with a patient named Patricia, aged 66. She had been taking calcium and vitamin D for years. Her vitamin D blood level was 32, which her previous doctor said was adequate. Her bone density continued declining. She developed calcium deposits in her coronary arteries. When we checked her vitamin K2 status, it was severely deficient. We increased her vitamin D3 to achieve blood levels between 50 and 70, added vitamin K2 at 180 micrograms daily in the MK7 form, and optimized her calcium intake from food rather than high-dose supplements. Within 12 months, her bone density scan showed a 4.2% increase in hip bone density and 3.8% increase in spine bone density. Research shows that combining vitamin D3 at levels sufficient to reach blood levels of 50 to 70 nanograms per milliliter with vitamin K2 MK7 at 180 to 360 micrograms daily significantly improves bone density and reduces fracture risk, while simultaneously reducing arterial calcification. Another critical factor is understanding that vitamin D deficiency is epidemic in people over 60. Your skin becomes less efficient at producing vitamin D from sunlight. You spend more time indoors. You use more sunscreen when outside. You may have kidney function decline that reduces vitamin D activation. Many seniors have vitamin D levels below 20, which is severely deficient. Some have levels below 10, which is critically deficient. At these levels, bone loss accelerates dramatically. There is also a dangerous misunderstanding about vitamin D dosing. Some people believe the recommended daily allowance of 600 to 800 IU is sufficient. In reality, most seniors need 2,000 to 5,000 IU daily to achieve optimal blood levels. Some need even more depending on body weight, sun exposure, and absorption capacity. The key lesson here is simple. If you are over 60, taking calcium without optimized vitamin D3 and K2 is like trying to build a house by dumping lumber in the yard without workers or tools. The materials are there, but nothing gets built. Optimizing these nutrients allows your body to actually use calcium for bone rebuilding. Now we come to the second proven method, and this one saves thousands of seniors from fractures every year. Method number 2 is resistance training and weight-bearing exercise for bone stimulation. Many people think exercise is good for general health, but do not understand its direct effect on bone density. They walk casually or do light stretching. They avoid heavy lifting because they fear injury. Bone density does not respond to gentle movement. Your skeleton needs mechanical stress to trigger bone formation. I saw this pattern in a 69-year-old patient named James. He walked 30 minutes daily for 10 years. He thought he was protecting his bones through regular exercise. When his bone density scan showed osteoporosis, he was confused. Walking is excellent for cardiovascular health, but it provides minimal bone-building stimulus. When he started resistance training with weights, progressive overload, and impact exercises, his bone density began improving. After 14 months of proper strength training 3 times weekly, his follow-up scan showed measurable bone density, increases in both hips and spine, Another overlooked issue is the specific type of exercise that builds bone. Many seniors do exercises that feel good but provide no bone-building benefit. Swimming feels great but provides zero bone-building stimulus because water supports your body weight. Cycling is excellent for cardiovascular fitness, but does not load bones enough to trigger formation. Gentle yoga improves flexibility but lacks the mechanical load bones need. For most seniors, the essential bone-building exercises include resistance training with weights or resistance bands focusing on major muscle groups, weight-bearing impact activities like walking with a weighted vest or jogging if joints allow, balance exercises that also load bones like single-leg stands with progression, and exercises that load the spine safely like standing rows and overhead presses with light weights. The key principle is progressive overload. Your bones adapt to the stress you place on them. If you lift the same light weights for years, your bones adapt once and then stop improving. You must gradually increase resistance over time. I had a patient age 72 named Dorothy who was afraid of lifting weights. She believed seniors should avoid heavy resistance to prevent injury. Her bone density was declining steadily. We started her with resistance bands and bodyweight exercises. Within 3 months, she progressed to light dumbbells. By 6 months, she was squatting with 15-pound dumbbells and doing overhead presses with 8-pound weights. By 12 months, her strength had doubled, her balance improved dramatically, and her bone density scan showed her first increase in 8 years. That resistance training saved her from future fractures. By this point, you may realize something important. Most seniors are not refusing all exercise. They are doing the wrong type of exercise for bone health. Gentle walking and stretching feel good, but do not rebuild bone. Each month without proper resistance training allows continued bone loss. Together, these gaps can lead to fractures that end independence. Now let me walk you through the third proven bone rebuilding method for seniors. This is the approach I use with my own patients over 60. Method number 3 is optimizing protein intake and bone matrix nutrition. For most seniors, calcium gets all the attention, but bone is not pure calcium. Bone is a living tissue made of protein matrix with calcium minerals deposited within it. Think of bone like reinforced concrete. Calcium is the concrete. Protein is the steel rebar framework. Without adequate protein, you cannot build strong bone regardless of calcium intake. Older adults often eat insufficient protein. They have smaller appetites. They avoid meat due to cost or digestive issues. They fill up on carbohydrates and neglect protein. This protein deficiency directly weakens bones. Research shows that seniors consuming less than 0.8 grams of protein per kilogram of body weight experience faster bone loss. Optimal bone health requires 1.0 to 1.2 grams per kilogram, sometimes more. I had a patient named Helen, age 70, who was vegetarian and eating primarily pasta, bread, and vegetables. Her protein intake was approximately 35 grams daily. Her body weight was 68 kilograms, meaning she needed at least 68 grams daily for bone health. She was getting half of what she needed. Her bone density was declining despite calcium and vitamin D supplementation. When we increased her protein intake to 75 grams daily using Greek yogurt, cottage cheese, beans, lentils, tofu, and protein powder, her bone density stabilized within 6 months. By 14 months, she showed measurable improvement. The protein gave her bones the structural matrix needed to incorporate calcium. Beyond total protein, specific amino acids matter tremendously. Collagen contains unique amino acids like glycine, proline, and hydroxyproline that directly support bone matrix formation. Supplementing with collagen peptides at 10 to 15 grams daily has been shown in multiple studies to improve bone density in postmenopausal women. Other critical bone matrix nutrients include magnesium, which activates vitamin D and is required for over 300 bone-building enzymatic reactions. Most seniors are magnesium deficient. Optimal intake is 400 to 500 milligrams daily from food and supplements. Boron, a trace mineral that reduces calcium excretion and supports vitamin D metabolism. Just 3 milligrams daily significantly improves bone health. Silicon, which strengthens the collagen matrix of bone. It is found in whole grains, green beans, and mineral water. Vitamin C, which is absolutely essential for collagen synthesis. Without adequate vitamin C, Your body cannot build bone matrix. Seniors should consume at least 200 milligrams daily. Zinc, which supports bone-building cells called osteoblasts. Deficiency accelerates bone loss. Omega-3 fatty acids from fish oil, which reduce inflammation that breaks down bone. Studies show 1,000 to 2,000 milligrams of combined EPA and DHA daily support bone density. A comprehensive approach means getting adequate amounts of all these nutrients, not just calcium. I had a 67-year-old patient named Thomas who was taking only calcium supplements. His bone density declined every year. We implemented a complete bone nutrition protocol: protein at 1.2 grams per kilogram body weight, magnesium 450 milligrams daily, collagen peptides 15 grams daily, boron 3 milligrams daily, vitamin C 500 milligrams daily, omega-3 fish oil 2,000 milligrams daily, and whole food sources of silicon and zinc. Within 10 months, his bone density measurements improved for the first time in 6 years. That complete nutritional support gave his bones everything they needed to rebuild. At this point, it is important to understand one critical truth. Bone rebuilding is possible at any age, but it requires comprehensive support, not just calcium pills. One of the most common issues is calcium supplement timing and type. If you take calcium carbonate, which is the most common and cheapest form, without food, you absorb almost nothing. Calcium carbonate requires stomach acid for absorption. Many seniors have low stomach acid. Calcium citrate absorbs better and does not require stomach acid, making it superior for most people over 60. Another overlooked factor is calcium dose timing. Taking 1,000 milligrams all at once overwhelms your absorption capacity. You can only absorb about 500 milligrams at a time. Splitting doses improves absorption. Calcium supplements can also interfere with other nutrients. Taking calcium with iron blocks iron absorption. Taking calcium with thyroid medication blocks thyroid medication absorption. Taking calcium with certain antibiotics blocks antibiotic absorption. Timing matters tremendously. There is also the issue of getting calcium from food versus supplements. Dairy products, leafy greens, sardines with bones, and fortified foods provide calcium along with other bone-supporting nutrients. Food sources come with protein, magnesium, vitamin K, and other cofactors that improve calcium utilization. I encourage most patients to get 600 to 800 milligrams from food and supplement only if needed to reach 1,000 to 1,200 milligrams total daily. This approach provides calcium without excessive supplementation that can cause problems. I want to share a quick example. A 74-year-old woman named Barbara came to me taking 2,000 milligrams of calcium daily in supplement form. She had developed kidney stones twice. Her coronary calcium score, which measures arterial calcification, was dangerously high. Her bone density was still declining. We cut her calcium supplements to just 400 milligrams daily and increased her dietary calcium from Greek yogurt, cheese, and leafy greens. We optimized all her other bone nutrients. Within 8 months, her bone density stabilized. She had no new kidney stones. Her arterial calcification did not worsen. Getting calcium balance right made all the difference. Now, let us continue with the fourth proven bone rebuilding method. Method number 4 is addressing hormonal factors and medications that destroy bone. Many seniors do not realize that certain common medications accelerate bone loss dramatically. Proton pump inhibitors for acid reflux, taken by millions of seniors, reduce calcium absorption significantly. Corticosteroids like prednisone, often prescribed for inflammation or autoimmune conditions, cause rapid bone loss. Certain diabetes medications, some blood pressure medications, and several antidepressants all negatively impact bone density. If you take any of these medications long-term without bone protection strategies, your calcium supplements will not overcome the drug-induced bone loss. I saw this clearly with a 65-year-old patient named Margaret. She had been taking omeprazole, a proton pump inhibitor, for 9 years for acid reflux. She took calcium supplements faithfully. Her bone density declined steadily every year. When we addressed her acid reflux through dietary changes, stress reduction, and eliminating trigger foods, she was able to stop the omeprazole. Within 6 months off the medication, and with proper bone support, her bone loss stopped. By 12 months, she showed improvement. That medication had been sabotaging her bone health for years. Hormonal changes also devastate bone density, especially in women. After menopause, estrogen levels plummet. Estrogen directly protects bone by inhibiting bone breakdown and promoting bone formation. Without estrogen, bone loss accelerates to 2 to 3% annually for several years. Some women lose 20% of their bone density in the first 5 to 7 years after menopause. Hormone replacement therapy can prevent this loss, but many women avoid it due to fear or misinformation. For men, testosterone decline also accelerates bone loss. Low testosterone in older men is associated with increased fracture risk. Checking and optimizing hormone levels when appropriate can significantly protect bone density.